Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, Vaccine Schedules Standard versus Alternative. In the United States, the immunization schedule for children 0 to 18 years of age is based on recommendations of the Advisory Committee on Immunization Practices, ACIP, an independent group of experts housed within the Centers for Disease Control and Prevention, CDC. A total of 14 vaccines are included in the ACIP recommendations. /R/N/R/N. There are also alternative schedules that are not endorsed by any public health authority. These include schedules from pediatrician Robert Sears, aka Dr. Bob, cardiac surgeon Dr. Donald Miller, and others. Due to misinformation and increasing rates of vaccine hesitancy, up to 1/3 of children in the United States are currently on an alternative vaccine schedule. /R/N/R/N. The Advisory Committee on Immunization Practices ACIP is a committee tasked with preparing recommendations for the routine vaccination of adults and children. /R/N/R/N. The committee is made up of 15 members who meet 3 times yearly to review data and vote on vaccine recommendations. ACIP recommendations are made with the input of the American Academy of Pediatrics, AAP, American Academy of Family Physicians, AAFP, and others. /R/N/R/N. In the United States, ACIP statements are official federal recommendations. /R/N/R/N. To ensure that parents can make an informed choice about childhood vaccinations from birth to 18 years, the National Childhood Vaccine Injury Act requires all healthcare providers to provide parents or patients with copies of vaccine information statements before administering a vaccine. /R/N/R/N. Vaccinations are scheduled at an age when they are most beneficial. Vaccinations usually are delivered in a series of doses to build durable immunity to the disease. /R/N/R/N. In the United States, the first round of vaccinations starts at the time of birth and continues every 1 to 3 months until the age of 15 months. /R/N/R/N. The 11 vaccines that will have been started, and in some cases completed, between birth and 15 months are /R/N/R/N. There is also a nasal spray flu vaccine called FluMist, which is available to healthy children 2 years of age and older. With the exception of the age restriction and the route of administration, 1 spray into each nostril, FluMist is given on the same schedule as the flu shot. /R/N/R/N. Some of the above-mentioned vaccines will continue to be given during this period. Your child will have completed all of the vaccinations they started early in life by the time they are 4 to 6 years old, with the exception of the flu vaccine, which they must get every year. /R/N/R/N. They will receive these 3 additional vaccines, which ideally will be completed by age 18. /R/N/R/N. Many of the recommended vaccines can be delivered at the same time. To further ease the vaccination burden on children, 5 combination vaccines have been approved for use in the United States by the Food and Drug Administration, FDA. /R/N/R/N. Get our printable guide for your next doctor's appointment to help you ask the right questions. /R/N/R/N. Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. /R/N/R/N. Thank you. Form.email, for signing up. /R/N/R/N. There was an error. Please try again. /R/N/R/N. While the ACIP directs the federal recommendations for vaccinations, and, in turn, their coverage in health insurance, it is up to the state to determine which vaccines children are required to have to go to school or daycare. Not all of the ACIP recommendations are taken up by the states, but the majority are. /R/N/R/N. One common exception is the human papillomavirus, HPV, vaccine, which is only mandated in Hawaii, Rhode Island, Virginia, and the District of Columbia. /r/n/r/n states will allow for a varying degree of medical, religious, and philosophical exemptions, wherein parents can opt out of certain vaccines without the threat of having their child barred from participating in school, sports, or other activities. /r/n/r/n alternative immunization schedules are those that veer from the ACIP recommendation, either in terms of which vaccines should be given or when they are given. /r/n/r/n These alternative guidelines are often based on personal or anecdotal evidence and have not undergone the rigorous safety and efficacy research used by ACIP to make its recommendations. No alternative immunization schedule is endorsed by any medical association in the United States. /r/n/r/n Many of these schedules are designed by vaccine critics or skeptics, some of whom suggest that receiving so many vaccines before the age of 2 overburdens a child's immune system and is potentially harmful. /r/n/r/n These alternative schedules are broadly categorized by 4 themes, /r/n/r/n 2 widely published alternative schedules called the Donald Miller User-Friendly Schedule and Dr. Bob's Alternative Vaccine Schedule incorporate many of these features. /r/n/r/n The Donald Miller User-Friendly Schedule, first published in 2004, was written by a cardiac surgeon and professor of surgery at the University of Washington, Seattle. /r/n/r/n Miller's schedule is based largely on personal observation and the foundational belief that medicine is not a science. In an article published in 2014, Miller argued that populations cannot be tested to demonstrate strict regularity of outcome in every individual. /r/n/r/n In response to these beliefs, Miller proposed a more user-friendly approach that he insists is safer than ACIP recommendations despite a lack of supporting evidence. /r/n/r/n This includes /r/n/r/n developed by pediatrician Robert Sears, MD, aka Dr. Bob. This schedule spaces vaccines so that infants get no more than 2 at a time, meaning they will need almost monthly shots for the first year. Sears' views are based on the disproven concept of antigenic overload, in which the body is said to over-respond to vaccines and make a child unnecessarily ill. /r/n/r/n A well-known vaccine critic, Sears stated in 2014 that the disease danger is low enough where I think you can safely raise an unvaccinated child in today's society. /r/n/r/n Sears' 2007 best-selling book, The Vaccine Book, Making the Right Decision for Your Child, was said to have sold over 180,000 copies and garnered endorsements from many celebrities. /r/n/r/n According to Dr. Bob's schedule, immunizations are rolled out as follows, /r/n/r/no, vaccines do not overload or overburden the immune system. Every day, a child's immune system is exposed to and successfully fights off thousands of germs. With vaccination, a child is simply getting a weakened or dead version of a germ that does not cause disease but instead helps reduce the risk of a more serious infection from the live germ. /r/n/r/n A national survey conducted by the OP reported that 87% of pediatricians received requests from parents for an alternative immunization schedule, with the primary concern being the overburdening of the immune system. /r/n/r/n While vaccine hesitancy and vaccine complacency are hardly new phenomena, the rise in social media disinformation has led to a rise in the number of undervaccinated children in the United States. /r/n/r/n In 2016, 69.7% of children in the U.S. completed the vaccine series recommended by ACIP by age 24 months. By 2021, that number had dropped to 35.6%. /r/n/r/n Despite this, many pediatricians are accommodating parents' requests for adjustment to the ACIP schedule. According to a 2017 survey in Clinical Pediatrics, 58% of pediatricians reported frequent alternative immunization schedule requests and 24% reported feeling comfortable using them. /r/n/r/n And this is despite the fact that low vaccination rates have given rise to vaccine-preventable diseases in the United States and abroad, including measles, varicella, and rotavirus. /r/n/r/n According to a statement issued by ACIP, any changes in the immunization schedule that leads to an increase in exposure to preventable disease will increase the spread of the pathogens responsible for these diseases. /r/n/r/n Vaccine schedules are designed to ensure that a child is protected from preventable diseases. The recommended schedule from the Advisory Committee on Immunization Practices, ACIP, helps prevent diseases that, in the past, caused large numbers of children to become sick, disabled, paralyzed, or die. /r/n/r/n Despite these gains, vaccine hesitancy and misinformation have fueled the rise of alternative immunization schedules which remain unsupported by research and unendorsed by any major health organization. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.